Good afternoon, students. In yesterday's lecture, we discuss about the points of criticism. We will revise first the points of criticism or mistakes in Kant's repertory. After publication of Kant's repertory, other existing repertories were used less and less because of the completeness of Kant repertory, because it contains all mental general symptoms, physical general symptoms, as well as particular symptoms related to parts or organs. So due to its completeness, it was used, or most of the homeopaths, they choose Kant repertory for repertorization, and other repertories were used less as compared to Kant repertory. As it was an elaborate work, naturally some mistakes are bound to occur, and these mistakes which we discussed yesterday are in Kant's repertory at some places in front of general rubrics, some medicines which are important for that rubric which were not mentioned in general rubric, or at some places it was mentioned in sub-rubric but it was not mentioned under or in front of general rubric. We discussed the examples of this mistake, that is delusion. In front of delusion, Drosera we cannot found in general rubric, but it was found in sub-rubrics, and it was important, though it was important for delusion, it was not given in general rubric. Then, as he was critic of Dr. Boning Hussain, and then also in his repertory we found the medicines which are written under parts, as well as some clinical rubrics, diagnostic rubrics we found in his repertory, like edema, anemia, pulmonary edema, anemia, pneumonia. Such clinical rubrics, diagnostic rubrics we found in Kent repertory, as well as rubrics on organ, that is liver, spleen affection, affection of heart. Such rubrics we found in this repertory, though he was criticizing on Moning Hussain, his concepts, then also he included such rubrics in his repertory. Then extremities chapter, as it was less useful but it was too much elaborate chapter. There is over generalization in mind section. In mind section also there is it was explained in detail, so there is over generalization in mind section and over particularization, especially in extremities section. And this extremities section, which was not that much useful for repertorization. Then there are many similar rubrics which make the confusion for the beginners. The meaning of the rubric is same, and in front of such similar meaning rubrics, the group of remedies which are given, they are different. For example, fear, timidity, frightened easily, such rubrics are, the meaning of these rubrics are same, but they are given as a separate rubric in repertory. Some rubrics which we found at different places in the repertory, the similar meaning rubrics or the similar rubrics, it may be in one section or it may be in different sections with different group of remedies. So it was the confusing fact for the beginners, that which rubric we can choose for the repertorization, and to find out the exact rubric, it was difficult task. Then as the modalities are very much important to find out the simillimum, but in modalities, the list of uh, group of medicines in general rubrics and sub rubrics, it was different. Then as Dr. Kent, he was he was using noswords frequently in his practice, but in his repertory the use of or noswords are not mentioned with that much importance, or they were not represented well in his repertory. Then many rubrics, in front of many rubrics, we found that some important medicines indicated for that particular rubrics, which are mentioned in materia medica as an important symptom in that medicine. Such medicines we cannot found at many places in this repertory. As we discussed, example of cyclamen. In cyclamen, faintness during menses, this is important symptom, but when we go through the repertory, we found under faintness, menses during cyclamen is absent in repertory. So in this way, many drugs which are important, they were not mentioned in the repertory properly. Then many in mind section, many mental rubrics, they contain only, or they have given only one remedy, and so these rubrics are not useful for the repertorization. As well as Dr. Kent, he was giving importance to physical generals, but thermal conditions, they were not mentioned properly or separately in this repertory. So these are some points or some mistakes which take place by Dr. Kent while constructing his repertory, and many homeopaths, they criticize on these mistakes. Now we will discuss about the applied aspect of Kent repertory. In yesterday's lecture, we discussed about some practical guidelines, in which section, which type of rubrics we have to find out. First, we discuss about the applied aspect of Kent repertory. As we know, philosophy of Dr. Kent, that is, according to Dr. Kent, man is the will and the understanding, and the house which he lives in is his body. We all know, we discussed all about these things under the philosophy of Dr. Kent, that according to Dr. Kent, we cannot consider the part or organ, but we considered a man as a whole. Then what is man? Man is nothing but will and understanding, and memory. So man is the will and understanding, and our body is nothing but the house in which man lives. So a man is the will and understanding, and the house which he lives in is his body. In perceiving what is to be cured, to be diseased, one must proceed from general to particular. Study disease in its most general features, not as seen upon one particular individual, but upon the whole human race. So, what is to be cured in disease? To find out which things or which thing we have to cure in the patient, we have to cure in the disease. To find out this, we should have go from general to particulars. Means we should have to find out the root cause of the disease. We directly cannot go towards the result of the result, but we have to find out the cause of the disease. So we have to go from general to particular and study disease in its most general features. We should study the disease in its most general features, not as seen upon one particular individual, but upon the whole human race. So we have to study disease in its most general feature. We have to give importance to general features according to Dr. Kent and not as seen upon the particular individual, because these are the particular symptoms or the individual symptoms of any disease or any organ. These are nothing but the expressions of the inner disturbances. So we have to see, we have to give importance to general features and not to the particular patient or his part or his organ, but upon the whole human race we have to give importance. Means we have to give importance to general symptoms first while curing the or while treating the patient, while curing the disease. Then common symptoms versus general symptom. Most important is that common symptom that we say are not generals, that is general symptom. So general symptoms are different and common symptoms are different. Common symptoms are symptoms of disease, where general symptoms are symptoms of patient. What are the, if the person is suffering from so and so disease condition, then common symptoms are related to that disease condition. If the person is suffering from pneumonia, then the symptoms of pneumonia or the symptoms of his diagnostic condition, these are nothing but the common symptoms, and the general symptoms are symptoms of patient himself. General symptoms are the symptoms related to mind. Then the symptoms related to his physical general, that is his thirst, appetite, sleep, dream, urine, perspiration, bowel habits. So all these are related to patient himself. So according to philosophy of Dr. Kent, common symptoms are symptoms of disease, whereas general symptoms are symptoms of patient himself. Common symptoms are prolapsus, a common symptom, and in it, it is a common thing to say, "Doctor, I have such a dragging down in my bowel as if all my insides were coming out." This is the common feature and is a common symptom of the patient. So this is the common symptom of the disease. So this is the difference between common symptom and general symptom. Then Kentian approach while treating the patient. Then individualization of the sick. He first individualized the person. He gave prime importance to mental general, completeness of mental symptoms, Then secondary importance to physical general and particular symptoms, especially the characteristic particular symptoms used for differentiation of the remedy. Then completeness of mental symptoms. Specified mental symptoms qualified by modalities and sensation featured only in particular condition or sickness. For example, restlessness, heat during, clinging children in, sick when, fear death of, diarrhea during. So, how to complete the mental symptoms? The mental symptoms are specified, then it was qualified by modalities and sensation, then featured only in a particular condition or sickness. For example, in particular disease condition, it was related, the symptoms are came with the mental symptoms. For example, during heat stage there is restlessness. Then when the children are sick, when the child is sick, clinging, there is desire for clinging. Then during diarrhea there is fear of death. So featured only in particular conditions or sickness. In sometimes during sickness we found the mental symptoms, that is restlessness, heat during, clinging children in, sick when, and fear of death, diarrhea during. So we have to complete the mental symptom with the help of its modalities, its sensation, and is it present with any physical symptoms, physical characteristic or physical particular symptoms. Then physical general represent the essence of life affection. Which are physical general symptoms? About that we discussed previously. They are derived from common feature present in one or more particular symptoms. Common sensation or common modalities are represented as physical general. Location may be different. So the physical general symptoms represent the essence of life affection. They are derived from common feature which is present in one or more particular symptoms. Common sensation or common modalities are represented as physical general. Then location may be different. So in this way, the physical generals, they represent the essence of life affection and they are also important symptoms after mental general. Then characteristic particular symptoms. After physical general symptoms, we have to consider the characteristic particular symptoms. All those particular which are in opposition to physical general, they appear as rebellious symptom. These particular symptoms are totally different from physical general symptoms and they appear as a rebellious symptom. Then Kantian totality, how we have to construct the totality according to Dr. Kant. While constructing totality, we have to arrange the symptom in such a way that or we have to arrange the symptom according to the importance of the symptom in proper hierarchy, in proper order. So according to Dr. Kent, according to his philosophy, as he gave more importance to general symptoms and then he go towards particulars. So while constructing totality according to Dr. Kent's philosophy, first we have to collect symptoms related to mental general. Then we have to collect the symptoms related to physical general. And lastly, we have to consider the characteristic particular symptoms. Kantian approach has the flexibility to be applied to the common symptoms also. It is the need as in many cases symptoms are not uniformly presented as in text presentation. So it is not always that as we found the symptoms in the text, we get in the same way, in the same presentation while case taking, while from the history of the patient, from the patient, it is the need as in many cases symptoms are not uniformly presented. We cannot get the uniform proper symptoms which we get while taking the case in proper way. Case taking poses a challenge to many with limitation of their skill in observation. There exists a wide gap between the observed fact and reality. So many times the patient, he does not give symptom in very easy way. We have to convert the patient's language into the language of repertory, into our homeopathic language, and so the observed facts, the observed or the symptoms which we get while case taking, there is huge difference, or we have to give them proper uh, we have to arrange these symptoms in proper repertorial language, so that or then only we can get these symptoms in properly. So according to Dr. Kent, there exists a wide gap between observed fact and the reality. Presentation of common symptoms are visible easily and attract first attention. So the common symptoms which we get easily in the case and which attract the attention of the physician first. As such, one has to develop an approach to enter into cases by interpretation of common symptoms. So to enter into the case, we have the common symptoms. They are very much useful and they are easily visible. We get these symptoms very easily and we can easily develop an approach and easily get the common symptoms in the case. Common symptoms are closely related to the common behavior of human life. As such, they represent the basic nature. Why common symptoms are easily they are important, and how they easily as they are easily getting we get these common symptoms very easily, because the common symptoms, they are nothing but the behavior of the human life, as they represent the basic nature of that person. They represent the intensity, peculiarities in the occurrences, association of one symptom with another, and grouping of symptoms. So, common symptoms are closely related to the common behavior of human life, as they represent the basic nature, that is intensity, peculiarities in the occurrence, association of one symptom with another, and grouping of symptoms. Then utility of common symptoms, how they are important and how we can utilize these common symptoms. Common symptoms, when represented in group, they become peculiar to disease presentation. So these common symptoms are, they are peculiar to the disease presentation. They are peculiar symptoms. Common symptoms completed with modalities and sensation presents a characteristic feature in particular location. So when the common symptoms, we complete the common symptom with modality and sensation, it show a characteristic feature of in a particular location. So when common symptom is completed with modality and sensation, it is or it presents the characteristic feature of that particular location in that case. A case worked out on common symptoms. An infant presented with high fever, had diarrhea, and crying constantly with irritability. If there is a case of infant, what is infant? The child up to, yes, what is infant? The child up to 1 year, it is called as infant. And if the patient came, his infant with his parents with the complaint of high grade fever with diarrhea and irritability with cry, constant cry. Nose was watering and demanding water frequently. As there is high fever, there may be dehydration, so he demand water frequently and nose was watering. So in this case, how we have to work out the case? If the case is the infant patient with high grade fever, had diarrhea and irritability, he was constantly crying, his nose was watering, and patient was demanding water frequently. So how we convert these symptoms into brief? So first was the high grade fever. So in fever section, we have to find out the rubric intense heat, then diarrhea during fever, irritability during heat, coryza during fever, thirst, heat during. So in this way, we have to convert first the language of the patient into the language of the repertory. Means we have to convert the symptoms into rubric, that is in the repertorial language, and then we have to repertorize. When we use these symptoms for repertorization, then in this way, with the help of computer repertory, we can get the name of medicines which are indicated for that case. A mere bookworm symptom, hunter would see no difference between sickle and arsenic. Dr. J. T. Kent. So, a case cited for peritonitis with abdomen distended. A patient was restless, often vomiting blood and passing blood from the anus, horrible burning with the distended abdomen, unquenchable thirst, dry red tongue, lightning like pulse. So these are the symptoms of the patient. So we have to convert these symptoms into rubric. So in section mind, we have to find out the rubric restlessness. So first we have to do analysis, then evaluation, then make the totality of symptoms, and then make the repertorial totality. So in this side, on the left side of the table, we have seen some list of rubrics, name, first name of section, then name of rubric, or converting the symptom of the patient into the repertorial language that we call as rubric, with page number in front of that rubric. So this is called as repertorial totality. We have to write down in such way the repertorial totality. So we have to convert first the symptoms of the patient into the language of repertory, that is mind, restlessness, mouth, dryness. Dryness is the rubric and tongue is subrubric. Then under section stomach, thirst, unquenchable. Then under section stomach only, vomiting type of blood. Then under section abdomen, we have to find out the rubric distension, because there is distension of abdomen. And how was the abdominal pain? It was burning. So in section abdomen, we have, or we get the rubric pain, which is subrubric burning, of which the subrubric is burning. Then under generals, or under section generalities, we have to find the rubric pulse. Under generalities section, we get the rubric pulse, and under that pulse rubric, the sub-rubric fluttering is we get, and this is also very much important sub-rubric, that is under generalities section, the pulse rubric and fluttering sub-rubrics, which indicate the remedies related to that rubric. So in this way, we have to find out the repertorial totality of the case, and then we reach towards the group of similars, and from that we have to find out the similimum. In this case, after repertorization, there is arsenic which is having 19 marks, phosphorus which is having 17 marks, nickel core which is having 14 marks, stramonium which is having 10 marks. So from choosing one similimum, arsenic and sickle core have all these things equally, but when sickle is indicated, he wants all the cover off, wants to be cold, wants cold application, wants the windows open,